One of the reasons that I believe surgery for epilepsy is vastly underutilized is it suffers from a tremendous mythology about surgery on the brain. You can go back all the way to the first development of TV sitcoms. There was a program, Dr. Kildare. He was considered to be a great neurosurgeon. Richard Chamberlain played the role, mostly because his patients didn't die. And that was considered to be a big deal. And at the time it really was. In the 1950s, we had not come across a lot of the technologies that we use that make brain surgery really effective and very safe. Well, go forward 60 years, and the whole concept that brain surgery is associated with, some sort of loss of abilities is oftentimes more related to why the surgery was necessary in the first place and not because of the surgery. So somebody had a brain tumor. They took the brain tumor out to save someone's life, and they took out parts that they needed. Okay? Somebody had an aneurysm and it bled. That has a mortality rate, a death rate of 50%, mortality or a morbidity rate, a rate of loss of function of 75%. It's a big deal, but somebody does a brain operation afterwards, and everyone says, the brain operation caused all these problems. And that's the thing that leaves epilepsy surgery underutilized by 100-fold. So what we actually, I tell people is, look, we don't have any vegetables, okay? Doesn't happen. This is not what happens with epilepsy surgery. Do we have 1 in 100 people who is weak or can't think of the right words for things after the surgery? Yes. But those kind of problems will start to occur in our patients who continue to have seizures that are being treated with medicines and have not been candidates for surgery as well. So it's a complete terrible mythology. There are no vegetables after epilepsy surgery. But that is one of our big problems. And the surgery is very successful. 70% become seizure-free. Another 15% have a 90% reduction in their seizures. So we're talking about the number of seizures somebody might have in a month being now the number of seizures they have per year. I will say we have standards that our society, the Neurological Society and the Epilepsy Society, have had in place for 20 years. It's done little to improve the speed at which people get to surgery for epilepsy. It's still 20 years from the point at which they clearly are not responding to medications until they actually get the surgery intervention. 20 years is a lot of hardship, a lot of difficulty for people. And we don't know why that persists, but it persists everywhere. So our center sees exactly the same. We still see great responses to the surgery after those long periods of time, but we also recognize a tremendous loss of life.